Well, good afternoon, and thanks to everyone for joining us today, and for those that are watching from home. I hope that everybody is staying safe and healthy. I know you have one thing on your mind, and that's vaccine, so let's turn right to that. First of all, I want all of you to know that I understand your frustration. I know you're out of patience, and I am as well. Everyone across the country is tired of the pandemic. We all want to put COVID behind us and get back to normal. We know that vaccines are the way out, and everyone wants to get their shot now, and I get that. You deserve to know what's going on and what happens next. So today, we're going to talk about two major things. We'll talk first about how we are accelerating Virginia's work to get more shots in more arms faster. That has to do with supply and logistics, how we move that inventory around to get it in the right places. Then we'll talk about how Virginia is significantly expanding transparency, so you can know exactly what's going on. So let's get to it. I want to start by reminding everyone where we are as a country. The first shots became available in this country in the middle of last month. We told you then that the first shots would go to the people who are most vulnerable, healthcare workers and people living in long-term care. We estimated that to be about 500,000 people. Today, about a month later, more than 520,000 shots have been given in our Commonwealth. It's important to know that. It means that we are on track. It's also important to know that in just 1 month, more people have been vaccinated than have tested positive in the entire year of the pandemic, and that is good news. It's also important to remember how the system works. The federal government contracts with drug companies to manufacture vaccine. The feds then allocate doses to the states, and we then distribute them to hospitals, clinics, and others to give shots to people. You'll recall that we laid this plan out for you at a press conference not too long ago, and we said then that everyone should expect things to be bumpy at first. Let's talk about one reason why that is. People can get shots only if we have shots to give, and there has been a lot of uncertainty about that, especially over the past 2 weeks, and I'll give you an example. 15 days ago, the outgoing Federal Secretary of Health told states, open up eligibility to everyone 65 and over. We'll send more doses. If you don't expand eligibility, we'll reduce your supply. Then 2 days later, states learned that there were no more doses to release. That made a confusing situation even more confusing across the entire country. So it's not surprising that places that had doses held on to those doses. That led to a reality that is both too much supply in some places and not enough in others. That's true in Virginia and around the country. I'll tell you in a moment how we're dealing with this inventory management issue. But first, you need to know how this is being addressed at the national level and what our federal partners are doing to expand supply available to states literally starting tomorrow. I've spoken with the White House twice in the past week. Yesterday, I joined a call with the White House and governors of the 50 states. And what I heard was states dealing with all the same issues we're dealing with here in Virginia. Not enough supply, not enough transparency, lots of logistics, and not enough time to plan. I also heard something that I have not heard since the pandemic began, and that is a commitment at the national level to work together, find solutions, and get this moving so we can all get back to our lives. I heard a spirit of bipartisan cooperation. Big states, small states, red states, blue states, East Coast, West Coast, and the Heartland. I can't tell you how relieved I was to hear that. The White House told us two pieces of good news. First, states are going to receive about 16% more doses immediately. That starts with the orders we will place tomorrow. Second, they're locking in this increase. So instead of being forced to operate week to week, we will now be able to plan out a month. This is really good news, and it's one critical part of our plan to get more shots in more arms more quickly. But being able to do that and being able to plan a month ahead all depends on having a stable supply and trust that the supply will continue to roll in. So we turn to General Gustav Perna for answers. He is the Army four-star general who leads the federal supply effort. We asked, how can we be confident that we will receive these additional doses in the weeks ahead? He told us that after more than a month of working, the drug manufacturers have hit a stable, regular, sustainable cadence of production, and that is good news. He is confident they will deliver the doses they have committed to the nation, and that's why he and the rest of the Biden team are making the decision to allocate more doses to the states. And as we heard in the news media, this is one critical step that will allow all Americans who want a shot to get one by the end of this summer. That's our country's goal, that's Virginia's goal, and Virginia is prepared to deliver. I got off that call and met with our team. I told them, this is good news, this is our goal. And I said, people are counting on us to work harder and faster to meet it. So let me tell you where we are at the state level in Virginia and what we're doing to accelerate. Here's our progress at giving shots. We have given 594,828 shots, putting us 11th among all the states, giving more shots than 39 other states. On a population basis, we have reached about 7,000 per 100,000 people. That puts us 26 among the states and the District of Columbia. This puts us right in line with our neighbors like Maryland, North Carolina, and Tennessee. You'll recall that 2 weeks ago, we set an initial goal of doing 25,000 shots per day. Well, we have met that initial goal, and in fact, we are now exceeding it. Our average is over 26,000 shots a day. And that's good news. Here's where we are now. 64.2% of first doses have been administered. Now, let's talk about how we're going to accelerate it and move toward our next goal of 50,000 shots per day. We start with vaccinating people who are most vulnerable, starting with older people who live in long-term care. As you know, the federal government brought CVS and Walgreens in to vaccinate people who live in long-term care facilities. They've been doing a good job, and they've been doing what the federal government asked them to do. But I spoke to their leadership last week and asked, what's your timeline to vaccinate everyone living in these facilities? The answer was later in February, as the federal government wanted. I said, we need you to please do it faster. They agreed, and I'm grateful for what they have done. Their fast action means more shots in more arms in Virginia, and this is good news. We're grateful to have these companies here with us today. I'd like to introduce Dr. James Satterfield from Walgreens. He is their Regional Healthcare Director, responsible for Virginia and states from Delaware to Pennsylvania. And then we will hear from CVS. We're joined by Dick DeCassian, who is also a Divisional Vice President for CVS. So Dr. Satterfield and then Dick DeCassian, welcome. Thank you.
Thank you, Governor Northam. James Satterfield with Walgreens. Do want to give you an update of where we are as a company when it comes to the long-term care facilities, specifically skilled nursing facilities and the other long-term care facilities. So as you all may know, we started the COVID-19 vaccine portion with the Centers of Disease Control and Pharmacy Partnership for Long-Term Care on December 28th. Since that time, we've completed 92 skilled nursing facilities and are in the process of pulling forward and completing our assisted living facilities as well. Those assisted living facilities beyond the skilled nursing facilities, 94% of those will be completed by the end of the month, with the remainder being completed by the first week in February. Currently, we've given over 18,500 shots to the most vulnerable in those long-term care facilities, and look forward to completing those doses in the required timeline. So do want to thank the governor and his staff and others for helping us collaborate through this process and continue to support those who are most vulnerable in our communities. Thank you.
Thank you, sir. Appreciate it. Well.
Good afternoon. I'm Dick DeKessian, Division Vice President for the Mid-Atlantic for CVS Pharmacy. First of all, I want to thank you, and thank you, Governor, for supporting us and your true partnership in this endeavor. We've got a dedicated team of healthcare professionals, pharmacists, nurse practitioners, and technicians that are helping us with this endeavor, and excited to be a part of this solution for Virginia to ensure that we're helping to get more shots into more arms. With that being said, just to review, as far as the contract was concerned, there were two, as far as the two facilities that we were going to go into. Number one was the skilled nursing facilities, and then also secondarily would be the assisted living facilities and other facilities. So with that, as far as where we're at today for CVS, our first round of COVID vaccination doses, we've gone to 195 skilled nursing facilities that we were dedicated to vaccinating, and have completed those. And right now, we're about halfway through those as well, and plan to complete those on the second doses by February 8th. Today, we've had 43,000 doses administered within skilled nursing facilities. Also, we started administering to the assisted living facilities, which Virginia activated on January 11th, and within 3 weeks, we'll have all 611 facilities completed, except for about 3% of those, which was delayed only because the facilities asked to do it at a later date, which will be the following week after that third week. And today we've administered 20,000 doses within assisted living facilities. So we are on target with our goals within completing these within 3 weeks, and then also completing the second doses within 3 weeks thereafter. So in addition to that, we're in conversations with the Commonwealth as far as how we can partner and use our retail resources to help them do the general population as well. And I know that we had a conversation with the governor just last week to figure out ways in which we can help support them and make sure that we can get more shots into arms. So we're grateful for that as well. So it's been a Herculean effort. We're certainly humbled by that. My teams are humbled in going into these facilities, and we got family members looking in the windows and supporting us, cheering, and really crying when this happens. And we know and we understand the purpose of this, and we are truly dedicated to help support this in any way we can. So thank you.
Sir, thank you. Appreciate it. These pharmacies are doing very important work, reaching people who are at most risk. The faster they get done, the faster more shots can get to the next groups across Virginia. We'll talk more about next steps with our pharmacies in upcoming briefings, but for today, I want you to know how much Virginia appreciates your work, so thank you. So that's what we're doing with pharmacies to get more shots in more arms faster. Now, let's turn to our hospitals. Here's where we are. Healthcare workers were also included in the first round of eligibility. Many of them work in hospitals, so lots of doses went to hospitals to cover them for both first and second doses. Hospitals have been working hard to vaccinate their employees. They should be done with their first doses. So my message to hospitals is this: there's no excuse for first doses to be sitting there unused. Get them out and get them into arms now. We're also working with hospitals and local health districts to make sure they're not holding on to too much supply of second doses, especially if they won't need it for several weeks. So my team and I have been working the phones, asking hospital companies to shift excess supply to others who can get more first shots in arms right now this week. And hospitals have really stepped up, and I appreciate that. By shifting inventory around, we're going to be able to increase the number of shots this week by about 20%. That's about 40,000 more shots by this Sunday, on top of the 175,000 that were already planned, and that is good news. One of the leaders in this effort, and he has been here before with us, is Dr. Mike Mcdermott, CEO of Mary Washington Hospital in Fredericksburg. He has really stepped up, as have a lot of CEOs from other hospitals, and I'd like you all to hear from him today. So, Mike, thank you and welcome.
Thank you, Governor Northam. Good afternoon. I'm Dr. Mike Mcdermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare in the Fredericksburg area. I'm also the immediate past chairman of the Virginia Hospital and Healthcare Association. I want to thank Governor Northam for the opportunity to be here today and for the administration's ongoing collaboration with hospitals and healthcare providers across the Commonwealth as we continue to battle COVID-19, the pandemic, and we also work to vaccinate Virginians as quickly and safely as possible. Overall, Virginia hospitals have administered more than 318,000 vaccine doses since mid-December, and we are proud to help lead the way in this critically important life-saving work. To give you an example of how fast vaccination capacity is scaling within our hospitals, Virginia hospitals have increased vaccinations by 35% in the past week. The population of people vaccinated so far includes hospital staff, other healthcare professionals, and more recently, essential workers and vulnerable Virginians who are now eligible to receive vaccinations. As I look back at the last month, a few observations come to my mind. First, I was surprised that the federal Operation Warp Speed in the previous administration did not include plans for the last 12 inches of the vaccine effort, getting doses into arms, arguably the hardest logistical task in the process. Second, the lack of transparency from the previous federal administration preventing appropriate preparation for that formidable task. Nevertheless, our Commonwealth got to work, and we got to work at Mary Washington Healthcare. We immediately began our vaccination program with a paper-based system. We used that in our field hospital that we had converted early in the pandemic. Fast forward just a month, and we have since expanded to a fully digitized operation in our nearby Fick Conference Center on our hospital campus. And if I may, I'd like to just take a moment to tell you a little bit about that clinic. When our clinic is running at full capacity, we are currently able to vaccinate more than 2,000 scheduled people per day. When cars arrive, they are greeted, arrival is noted in our system, and they park to wait for a text message to be told to come inside to receive their vaccine dose. We do that to manage the number of people in the building at any time. Our scheduling system and on-site logistics work to efficiently move people through the process from registration and check-in, vaccine administration, to observation and second dose scheduling, and then departure. Many have marveled at this process, gushing that our operation is smoother than a Chick-fil-A drive-through. It's difficult to think of a greater compliment. Inside the clinic, the positive energy is palpable. It's an environment full of excitement and gratitude from patients and the clinic staff's satisfaction about being a service to our community. As a physician, I have done vaccination shifts myself at the clinic, and I can tell you that afterwards, you emerge filled with hope. As we look back, it's been a difficult year, and we've all been forced to sacrifice in many ways to help combat this global pandemic, but We've been resilient, we've adapted, and we've endured. I saw a great cartoon the other day where a child is looking up at her mother's upper arm, a round mark on the upper arm, and the child inquires, "What is that?" And the mom responds, "It's my smallpox vaccine scar." And the child asks, "How come I don't have one?" And the mother's response is, "Because it worked." Now we're fortunate to be receiving and distributing new doses of hope to our community, paving the path out of this pandemic to a brighter future. To give you some perspective on our progress, we've administered more than 16,000 vaccine doses so far at Mary Washington, over half of those in the last week alone. This week, we expect to administer another 8,000 vaccine first doses. We currently have the capacity to do more than 2,000 doses a day, and our team has plans to implement even more capacity. We have a very strong partnership with our local health department and a shared purpose of working to vaccinate our Rappahannock region. I've shared with you our experience at Mary Washington Healthcare, but many Virginia hospitals have built similar clinics in a very short time, creating a tremendous amount of scale to be ready to administer more vaccine doses to our fellow Virginians. Across Virginia, hospitals are currently capable of administering more than 100,000 doses each week if there is adequate supply. Many other hospitals across the state have also set up clinic sites in partnership with local health departments and community organizations. In this past month, we have come so far. The metrics improve daily as systems get interfaced and caught up from our initial paper-based processes to be formally accounted for in the digital systems to reflect our true efforts to date. This administration is actively sourcing and redistributing vaccine to ensure timely administration of all available vaccine doses to citizens of the Commonwealth. Only a month into our efforts, we now share a common challenge, a limited inventory of vaccine doses based on what the federal government is able to send to the state. Under these challenging conditions, we're appreciative of proactive steps taken by the Northam administration to move even faster and get doses into the hands of people and organizations who can use them. As hospitals, we stand ready to support the Commonwealth in rising to the occasion by ensuring we have the capacity to administer these COVID vaccine doses to our fellow citizens. We have built an engine to help power this effort. We just need fuel in the form of COVID vaccine doses from our federal government to propel us forward to our brighter future. Thank you very much.
Thank you so much. Really appreciate it. Well, thank you so much to Dr. McDermott. And I just wanted to say a word that, when this pandemic started in Virginia back in March, the hospital, the healthcare systems have really had to step up, first starting with access to PPE, and then testing supplies, and then being able to get out and test individuals across Virginia, and they continue to do that, by the way. They have been there every step of the way, taking care of our sickest patients on a day-to-day basis. Their staffs are literally tired, but have never complained, and now they're part of the vaccination program and process. So on behalf of Virginia, we are blessed to have so many great hospital systems in Virginia, and I thank all of them for all that you've done. And we're in this together, and we're going to get where we need to be. Now, before we turn to the next steps on transparency, I want everyone to be clear about who is eligible for shots and how that works. Virginia is now allocating shots to communities based on population. The federal government allocated doses to states that way, and that makes sense. At the beginning, only healthcare workers were eligible, so we sent the shots where those workers are. Now, regular Virginians are eligible, so the shots need to go directly to them. Like every state, we expanded eligibility much more quickly than we expected. That's led to confusion about how to prioritize. So today, the Virginia Department of Health is issuing clear guidance to local health districts. Here is how to allocate your supply. Half of available doses should go for people aged 65 and older. The other half should be used for frontline essential workers and people who are at increased risk of severe illness, as the CDC identifies. You've seen this list of frontline essential workers before. It's first responders, teachers, and others that we have discussed before. These groups are about the same size, but they are very large. It will take several weeks to reach everyone, and I ask you to keep that in mind. I also ask you to remember, if you jump the line, you're taking the spot of someone who needs it more because of their health condition or the job that they do in Virginia. We'll all have to trust each other, and I'm asking everybody to do the right thing. Now, I want to turn to transparency. I know that that's on everyone's mind as well. We talked a lot about this with the governors yesterday, too. States around the country are reporting data in different ways, and that's not surprising. The CDC said they would on this. Here in Virginia, we are making changes. Right now, during this briefing, we are launching a new vaccine dashboard, and here's what it will look like. It includes more information and more clarity. And I know some of that print is hard to read. It's a busy slide. You can see how many doses have come into Virginia, where they have been delivered, and where they are sitting. You can see how many people have received their first shot, how many people have received their second, and how much of Virginia's population has been vaccinated. And that's good news. I want to talk specifically about data around race and ethnicity. It's really important to make sure that equity is built into the vaccination program and that you can see what's going on. So I directed the team to do more and to move faster. We are doing 3 things. First, on Monday, Health Commissioner Dr. Norm Oliver wrote to every clinician in Virginia and told them, collect this information, it matters for transparency. Second, we updated all of the relevant websites and customer-facing applications with these words. Please list your race, ethnicity during vaccine registration and at the time the vaccine is given. We ask because we want to ensure that our process for data collection and vaccine distribution is fair, equitable, and transparent to all Virginians. And third, I'm backing legislation from Delegate Lamont Bagby and Siobhan Donovan moving through the General Assembly that will make it a requirement to collect this information. It's the right thing to do, and it's a critical tool to provide you the transparency that you expect. Now, I've heard from a lot of people asking me the same questions. Where can I get a shot, and how do I sign up? How do I sign up my elderly parents? These are questions we expected to address in February, but like every state, we expanded eligibility much more quickly than we originally planned. That has led to confusion about where to sign up and when. That confusion is justified because the answer has not been clear, but we're going to have this fixed very soon. Right now, the solution is to go to your local health district's website or to call them. They've all been directed to create a vaccine registration system so they can take your information and organize appointments. But that's fragmented. It's fine if you can get through, but not nearly enough if you can't. So I've directed the Virginia Department of Health to stand up a single statewide system with a phone number and a website where every Virginian can go and have their information go to the right place. That is not ready today, but I expect it to be ready soon. And I've told the health department that this is a priority. I know this has been a source of great frustration for a lot of Virginians. I hear you, and we're getting this fixed. In addition, we expect to dramatically increase the size of our call center, adding more people to answer the phones. This isn't in place yet, but it also will be soon. I take this seriously. because I know that people just want answers. Even if the answer is that they can't get an appointment for a month or two, it's important that everyone knows how to find out where to go and how to sign up. Finally, I want to update you on a couple of other issues. As you know, we have a whole series of safety policies in place to protect people during the pandemic. Restaurant capacity is limited, bars are closed, social gatherings are limited, and more. We all know what they are. No one wants these rules around forever, so they are set to expire this week. But we need to keep them in place a while longer. So I will issue an executive order today extending the current policies through the end of February. We are ramping up vaccinations. This is no time to let down our guard. I also want you to know that the Department of Labor has made our temporary COVID workplace safety standards permanent. This includes standards around PPE, sanitation, record keeping, and plans and training around infectious disease preparedness in workplaces. These standards become permanent today. In closing, I want to say what is on everyone's mind. Vaccines are the light at the end of this long and dark tunnel, and they are a great reason for hope and optimism. I also want to acknowledge that everyone is out of patience, and I understand that. That's why I wanted to make sure that you understand the actions that we're taking to get more shots in more arms every day. It will take time to reach everyone, but we are reaching more people every day, and the pace is increasing. So I ask you to please do the right thing. Let the most vulnerable people get their shots first. Keep washing your hands, keep wearing your mask, and keep distancing from other people. It's the right thing to do to take care of each other. I also want to say a word to our team here at the state capitol and everyone working throughout Virginia in healthcare. You are doing heroic work. I want to thank you for stepping up in a big way. I know that you're exhausted and you're out of juice right when we're asking you to push even harder. I also know what you're capable of, and I have seen you rise to meet the job that needs to be done. We need you to do it once more, and I have faith in you, so thank you.